As Oleksii already mentioned, our topic today is data security regulations in healthcare, and I would like to say several words about me. Who I am? I'm lead business analyst. Currently, I'm working as a product owner at Unwell, and so it's a telehealth project. I'm half and a 1 year in this project, and but before this project and before my career in EPAM, I worked a lot in the product company who provided laboratory informational system software, and I dealt a lot with all kinds of regulations during this period of time, and except the usual HIPAA and PHI trainings and all the regulations related to these areas. I also had to deal with FDA compliance because the devices that we created during my projects, my work in the previous company, they were class 1 and class 2 FDA medical devices. That is why we dealt a lot with all the processes and all the requirements for such kinds of regulations. So I faced it a lot with all these kinds of regulations, specifically in the healthcare domain. And as you know, so the cost of any kind of violation of regulations are usually quite huge. The healthcare industry has always been an great target of for cyber criminals, and because the healthcare domain deals with high value patient data, and it also has quite low tolerance for downtime, because usually if patient has no ability to get proper information, it usually means that patient or provider of the patient, yes, has no ability, has no access to the patient's data. It usually means that this could disrupt patient care, and it is very, very important and critical situation. And cyber criminals usually try to find different ways to take advantage from the healthcare cybersecurity practices, try to find any kind of leaks and holes to benefit from them. And in recent years, the healthcare industry has seen a 55% increase of cybersecurity threats. It actually makes this area as a gold mine for cyber criminals. So it's very, very, very high demand level, high demand industry for the criminals. So you can see in this slide the cost of a data breach report. This report is usually created by IBM. It is sponsored by IBM, analyzed and published. So it is not the first year they provide this report. It contains a lot of information, but this slide is interesting in this, in this point of view, that the healthcare is in the first place here, and so this industry, it has a high cost in view of the of all these costs of the data breaches, and the average total cost of breach in healthcare, it is increased. It is increasing from year to year, and in 2021 it was a bit more than 9 million, and now it is more than 10 million for the end of 2022. And yes. And as for the challenges that we see in view of this industry, so cyber threats will continue to disrupt the healthcare sector because it's so important for them, so meaningful, and because if providers don't care and don't provide proper measures for secure their network, their information, it gives ability for different kind of cyber threats. And let's take a closer look to the challenges that we are usually facing in healthcare industry, and how different kind of efforts can help to improve the cybersecurity health. So digital transformation puts all industries in great risk. It is not only about the healthcare, but healthcare is no exception, as we already have seen in the previous slide. And the number of medical devices is constantly growing, especially during the last 2 years due to all this COVID situation and etc. So healthcare organizations increase their reliance on health information technology for data sharing, for processing, automatization, and system interoperability, exchange data, and so on. And this actually means that attack surface actually expands all the time, and the healthcare industry is most vulnerable to ransomware attacks, to data threat, and different kinds of compromises. And as you can see in the previous slide, this actually has consequences. Let's go further. So, cyber threats will continue to disrupt the healthcare sector, it is obvious. And if providers don't care about the proper measures and what challenges we actually facing in healthcare industry, so that we can understand these challenges and possibly can provide some ways how to improve the situation. So due to digital transformation, we have this great risk of cyber attacks, and the number of medical devices is constantly growing, so for healthcare organizations increase their reliance on health information technology, and this leads to threats to the security. These threats can be kind of malware and ransomware, as I already mentioned, and also the distributor dental or service attacks, and also data breaches and disclosure of health related information, and Internet of Medical Things, kind of so Internet of Medical Things so also provide the a lot of abilities for us as users, but each of us use some kind of medical things, and all these devices are definitely connected to different different networks, and this actually allows us to use all these features. And in parallel, we have these threats to the security, and also we have these insider threats. This actually means that this threat can go not only outside, but also can happen not only outside, but also inside the organization. This means that when we deal with insider attack, we provide the data encryption and zero trust access strategies in the companies. They are very vital to the security of sensitive patient information and data protection. And I also didn't mention the distributed dental denial of service attacks, and these are kind of attacks that that flood an organization network in such a way so that the organization cannot operate normally. And as for the ransomware and any kind of malware, it usually infects devices, systems, and files so that the organization that is a victim in this situation, they need to pay some amount of money or somehow deal with this very risky situation. And so many healthcare providers are switching to cloud-based data storage solution, and unfortunately, not all cloud-based solutions are HIPAA compliant. For example, I realized that Amazon Web Services that are widespread used, they do not actually meet all the HIPAA requirements. So it was very interesting for me to know this, but yes. And so how can we actually improve the security? So an effective cybersecurity risk management program will enable organizations to proactively monitor compliance and protect their networks. So they need to establish this risk management program, and we have different kinds of frameworks and law regulations that allows us to establish this kind of processes in the organization. What actually can we do in simple words? So we can establish kind of security culture in the organization and comply with healthcare regulations, processes, protect data and devices. Also, we need to have good controls and metrics to manage the risks and regularly monitor and provide internal or possibly external audits of our security health. So we already have seen that the fines for non-compliance and breach are really huge, and compliance with regulations helps organizations to avoid such hefty fines and save their money. Regulations allow organizations to use common existing security recommendations and organize their own safeguards at some consistent and measurable rate. And gaining formal certification, if organization does some actions and gain some certificates, this actually allows this organization to gain more credibility in the market, to gain trust. And also, if organization comply with some regulations, it is usually ongoing process. So you just cannot just go and organize some kind of process change, do audit, and that's it. It is ongoing process, and it actually helps to assess current security level at each moment of time you do this, and in the identify the areas of compliance and non-compliance. If you have this clear vision of what is going on in view of the cybersecurity, you can you actually see the next steps, and it gives you the ability to enhance and grow. So this is also the good way to grow and have good results. So before we will go to and see the next quite heavy slide, I would like to show you this funny picture. So it's by the way, I tried to find some joke for you about all the regulations about FDA particularly, and I asked ChatGPT-3 about some funny stories related to non-compliance of the with the regulations. And actually, it answered that this is not a funny topic at all, and it's incorrect to share such kind of jokes. So it was very interesting to understand that. So the GPT chat is also regulated, and I was not able to have any kind of such joke from this chat. Still, I have found several examples of how the non-compliance can look like. For example, in 2018, a medical device manufacturer from Texas was charged with criminal fraud for distributing misbranded and adulterated devices in violation of FDA regulations. And in 2017, the pharma company of New Jersey had to pay the $20 million in fines for failing to report safety information to the FDA, and it was also the violation of regulations. And as I promised, this heavy slide, here it is. So let's review the most common regulations, laws, and frameworks that we used to implement and maintain with in healthcare. So first of all, HIPAA. HIPAA stands for Health Insurance Probability and Accountability Act. It was created in 1996. So it's quite old document, and it was created to regulate the disclosure and protection of healthcare information. And we will review HIPAA in more details later, so I will not describe all the information now. And as for the HITECH, the next one, it's a HITECH Act. It stands for Health Information Technology and Economic and Clinical Health Act. Very long name. So it was created in 2009, and it actually enforces HIPAA. And provide more specific details to cover the gaps that we had in HIPAA, because HIPAA is quite old document. So the next one is NIST, is National Institute of Standards and Technology. It contains many publications and it is mandatory for all federal entities and their contractors, and it is not mandatory for private healthcare organizations. This basically means that this institute actually regulates only federal organizations that that act with government and possibly have some financial financial agreements with government. That is why they need to comply with this kind of regulation that is specifically necessary for the federal entities. The next one is Center of Internet Security. They provided their critical security controls, and these controls are kind of framework. They have 18 recommended actions how to protect your organization against cybersecurity. It is recommended and non-mandatory actually. The next one is COBIT, and it stands for Control Objectives and for Information and Related Technology. It's IT governance and management framework. It contains 6 principles to align IT processes with cybersecurity requirements. It's also not mandatory and used as is a framework to help the organizations to deal with the cybersecurity requirements. ISO, it's well-known organization. It's International Standardization Organization. The name says for it. It is widespread, and it is highly recommended for all the healthcare organizations, and it proposes a set of different kinds of certifications for different purposes. For example, ISO 97001 is international standard for data security. And high trust, it's a health information trust common security framework, and it helps to assist healthcare organizations and actually their cloud services providers, like as third-party companies, with demonstrating their cybersecurity measures and compliance. This framework is used to prepare for any kinds of audits. And this framework is actually mapped in a good way on USA healthcare laws, HIPAA and HITECH. The next one is quality system regulations. FDA is actually enforcing strict cybersecurity requirements for medical devices, and not only during the usage of medical devices, but also during the design process. And these quality systems aim to reduce cybersecurity risks. And so these QSR regulations, they are usually necessary to comply with when we deal with FDA. The 21st Century Cures Act, it was signed in 2016, and it enables and enhances access to electronic health information, and it improves the coordination between providers and all the information exchange. It mostly deals with blocked information and regulates the cases when the information is treated as blocked or it is treated as protected, and that is why it was not disclosed in a certain situation and case. So the next one is payment card industry data security standard. It is also international, and it regulates all non-cash payments such as payments by ATM cards, point of sale, prepaid credit cards, whatever. So all these cards and all these payments are under these regulations. And the last one, but not the least, is General Data Protection Regulation. It is a set of guidelines for the collection and processing of personal information of individuals within all the European Union. So this is kind of HIPAA and high tech, but for Europe, and it regulates not only the healthcare domain, but it's for all other domains. It is also applicable, and it is not dealing only with PHI, but all personal information. And also it is used not for the cases that happen in European region, but that happen to the European Union people. So if you work somewhere not in the European Union, it is still applies to you if you work with the data, personal information for the European Union people. So let's review the same regulations, but in terms of what countries are affected, and if it is mandatory or not, to understand how can we deal with them. So as for the United States of America, we have HIPAA, high tech, that are mandatory, and they are applicable for specific covered entities. I will describe it a bit later. So we have also NIST and quality system regulations. They are mandatory. NIST is mandatory for federal entities and their contractors, and quality system regulations are mandatory for medical device manufacturers, and it is required by FDA. So for Europe, we have a quite straight and forward GDPR, and it is mandatory for all organizations anywhere, as long as they target to collect data or deal somehow with data related to people in Europe. And the international set of frameworks, they are usually recommended, except the last one. So the PCI is mandatory for organizations that work with cardholder data. So let's speak about the HIPAA regulation. And so under HIPAA, we understand Department of Health and Human Services, and sorry. So not Department of the Health and Human Services. It's actually the department who established this law, and HIPAA stands for Health Insurance Portability and Accountability Act, and HIPAA applies to different kind of patient records, including verbal, written, and electronic variants of such records. And the use of electronic health records, it actually increasing. So the HIPAA was enhanced with high tech in in 2029, as I remember. So HIPAA requires covered entities, specific entities, to implement safeguards. So they need to ensure that the healthcare information is conducted with confidentiality, integrity, and availability. So so who are these covered entities? From the HIPAA perspective, these are health plans, healthcare providers, and healthcare cleaning houses. So as for the health plans, it's usually insurance companies, different kinds of health maintenance organizations, company health plans, Medicare, Medicaid, something like that. And as for the healthcare providers, it's the most widespread group. It's hospitals, doctors, clinics, whatever. So different kinds of nursing homes. These are healthcare providers. And one more category is healthcare clearing houses. And these are the organizations that take the information from healthcare entity and somehow deal with it, standardize, reorganize, and then pass out to another healthcare entity, for example. And as I have already mentioned, the HIPAA was established quite a long time ago, and after that it was enhanced with the high-tech law. And as for the EPHI and PHI information. So initially, this law, healthcare HIPAA law, it dealt mostly with non-electronical PHI, but soon it was enhanced with electronical PHI. So what information is protected healthcare information PHI? It includes these 18 items, and this any kind of such information is treated as PHI. For example, different names, identifiers, medical records number, insurance information, all the items that you can see in the list are affected. And so we also deal with electronical PHI information, and it includes any kind of PHI data but stored electronically. And sometimes some of the information is not PHI, and it can be treated as so in two conditions. The data cannot identify the patient, and all data it was disclosed because it is needed for covered entity during the course of care. So in this case, this kind of this kind of cases are not treated as disclosure of PHI information. And as for the HIPAA rules, so HIPAA proposes several rules. First of all, there were 3 of them, then basically 4 of them, and the first, the one omnibus rule, it was added later when the High-Tech Act was created. So the most important rule in the HIPAA is privacy rule, which actually outlines how PHI can be used and disclosed. And all other rules are kind of created to support the privacy rule. And the privacy rules establish standards for PHI security, and it also sets conditions when such information may be used without authorization from the patient. And the security rules are mostly needed to specify the security measures for electronic PHI and all the necessary required functionality to comply with HIPAA. HIPAA privacy rule. So we need our software to provide all necessary functionality and safeguards. The third rule is breach notification rule. It is created to regulate the notification process in case if any data breach has been discovered. And basically, what is the breach? A breach is an kind of disclosure, and it somehow compromises the security or privacy of the protected health information. And when it happens, we deal with a breach, and it requires to follow the breach notification rule, HIPAA regulations. And the last, not last, but the very interesting omnibus rule. It was created a bit later as a part of High-Tech Act, and it deals with electronic PHI, and it prohibits to use PHI for marketing and fundraising situations and also purposes, and also provides new penalty tiers. They are very strict and contain a lot of penalties and tiers to increase the number of healthcare organizations who actually comply with regulations, because for some period of time it was not so important for organizations to comply the HIPAA and High-Tech rules, because it was cheaper to pay penalties for them, but now it is not the case. And enforcement rule lays out how any resulting investigations are carried, if breach occurred, we need to investigate, and this law provides such guidance. So this slide just describes the different kind of safeguards, and as HIPAA proposes several rules, the most important rule is a privacy rule, and this privacy rule supported by different kinds of additional rules, and to fulfill all the such kind of regulations and follow the rules, we actually need to provide some safeguards. HIPAA defines 3 types of safeguards: administrative, physical, and technical. So administrative is mostly about practices, policies, and procedures to ensure that the electronic PHI is securely maintained. And the physical is about the establishment of physical security of building, different devices that contain PHI. And technical different kinds of technologies to provide access to PHI and protect from digital threats. The technical category, for example, it can deal with data integrity, kind of different backups, storage encryption, transmission security, and so on. So we already discussed a bit the HIPAA, and as for the high-tech, let's review it. With more medical providers using the EHR, data breaches have actually increased, and in 2009, the High-Tech Act was signed into a law as a part of American Recovery and Reinvestment Act during Obama governance, and it promotes the adoption and meaningful use of health information technology, and it actually encourages all the participants of the industry to use electronic health information. It considered as enforcement of HIPAA, and it mostly deals with additional covered entity. It is business associates. And also it encourages the meaningful use of electronic health records, by healthcare providers, and also their business associates. Business associates were not initially included in HIPAA, and this actually meant that the third-party organizations were not required to comply with regulations, and it provided holes in all the security processes. As I already mentioned, HIPAA was quite old standard, so the the new High-Tech Act tried to anticipate risk specifically associated with electronic health information, and it provides strong enforcement measures, kind of high penalties for non-compliance with HIPAA security and privacy rule, and it is required for all covered entities, including their business associates, and it also requires to provide security audits for all healthcare organizations. Let's go further. And as for the components of High-Tech, it provides set of programs, meaningful use program. It actually encourages providers to use EHR, and it even provides government compensation to healthcare providers who adopt and use the EHR information meaningfully. It requires healthcare information exchange, provider to patient increased exchange. Also, it deals with public health and clinical data exchange, meaning that different kinds of reports will contain information gathered from different providers in electronic way, so that all entire health system will win and have more data to analyze and provide better treatment for the patients. And also e-prescribing, meaning that patient can receive and order the information from the provider online, any kind of prescription. So as for the different kind of components, I already mentioned meaningful use, BA HIPAA compliance. So as for the BA HIPAA compliance, under HIPAA, business associates were supposed to have obligatory to comply with requirements. However, this was not so for the business associates, and usually they say that okay, we didn't know that they doesn't comply, they do not comply, and as a result, High Tech Act changes this to introduce and strict requirements for business associates too, and as for the breach notification rule, it was also enhanced to increase security requirements and penalties, and it also introduced mandatory breach data requirements under the breach notification rules. So nowadays, this breach notification procedure is more straightforward, and also HIPAA updated, actually vice versa. So High Tech Act updated HIPAA with the requirements regarding business associates. So now HIPAA contains the same rules regarding business associates as High Tech Act does. And as for the access to EHR, so prior to High Tech Act, HIPAA privacy rule gave patients mostly rules, patients and providers rules regarding how to deal with paper copies of the information, and now it is related, all the rules in High Tech Act are related to digital representation of healthcare information, and all the and provide the rights of access to allow individuals to see, obtain their health data in electronic way. And I would like to describe European standard that is quite similar to HIPAA, and this one is GDPR, and it is used for Europe, and the differences between HIPAA and GDPR are quite obvious. So the one that for Europe is used for all European people anywhere, and it is applied not only to the healthcare information but all individual protected information, including non-health related information. And in all other senses, these two laws are quite equal, and the GDPR is even a bit stricter. The next one is the 21st Century Cures Act. It mostly deals with the data blockers and how to deal with them. So to provide patients with greater access to care and implement new standards of the information exchange, this act was created, and it includes healthcare provider, IT companies that deal with health IT systems, different kinds of network and exchange information systems. And so this act actually requires to maintain HIPAA standards, and also to avoid information blocking. It means that these two requirements shall work together, and the law describes different kind of exceptions, in which case the information shall be treated as blocked in specific case, and in which cases this information is actually protected according to the HIPAA rule. So they describe different kind of exceptions, for example, privacy exception and security exception, and all such kind of details. And let's go further to the FDA, my favorite topic. And the Food and Drug Administration, FDA, is a federal regulatory agency, and it is responsible for controlling and of any safety and effectiveness of the country drugs supply, and for both animals and humans. And it is not only for drugs, but for different kind of areas such as food, drugs, medical devices, vaccines, blood, veterinary, cosmetics, and so on. So as a critical step, as it determines the type of permanent submissions and applications that will be required for FDA approval. So we need to somehow classify our medical device to understand what kind of regulations we will have in view of this type. So as you can see here in the picture, there are three classes of medical devices, and each of these classes provides their own regulations. The definition of class, it's actually based on level of control that is necessary to assure that safety and the effectiveness of the device is in the proper level, at the proper level. And classification, this classification is based on the product intended use and the indication for use, and also risks that this product poses. Intended use describes the general purpose of this medical device. Indication of use describes the disease or condition the medical device will diagnose or treat or somehow deal with, prevent, for example. And this also describes the target patient auditory. And risks also analyzed to understand to which of these three classes each device shall be added. So here we have the more specific picture of these three types of devices. And so as you can see, the class 1 poses the lowest risk, and it's low to moderate risk for patients and all users. And we have almost 50% of medical devices of this kind of class. And in my previous project, I dealt with the class 1 and class 2 medical devices. And for example, it can be bandage, some medical thermometers, stethoscopes, and so on. Class 2 pose moderate risk or even sometimes high risk to patients or intended users, and it covers almost 40% of all medical devices market. And for example, it's contact lenses, different kind of test kits, and all these devices are class 2 devices, and actually it's kind of difficult to understand to which class of devices your specific device will go. So, and we actually need sometimes to use additional help, kind of additional organizations that will assist us with this definition. But if in the FDA side, there is a lot of there are a lot of articles and laws that provides all the detailed information. It depends of how you would like to do this analysis. And as for the class 3 device, we have high risk, and only 10% in the market are class 3 medical devices, and these are devices that supports people's lives. And you can see here in the table all the classes definition, and you can see that depending on the class, we will have different regulatory controls. And like for class 2 and class 3, we will have specific procedures. For example, pre-market notifications to obtain the FDA certificate, and and for the subject and for the class 3 medical devices, we will definitely need to apply for pre-market approval, which requires clinical data to support we will provide this clinical data to support the safety and effectiveness, and we will need to provide proofs that our device is a high quality standard. And the devices of third class are usually used to sustain or support human life. So it's very important. And as we understand all the risks that the healthcare industry faces with, and all the regulations that we have for this industry, how can we deal with all this information? The value of connected media services is clear, because we have all this information and exchange benefits. It's beneficial for patients and consumers, healthcare institutions, and different kinds of providers. But when we see all these benefits of Internet of Medical Things and medical software, we still understand that due to the fact that the number of medical devices are growing, we still at risk, because the risk is growing for this industry too. And this actually results to data breaches. That is why it's very important to deal with all the regulatory standards and use different kinds of frameworks, and possibly provide audits and gain certifications. And it is not only important from the law perspective, but also because it helps a lot to deal with the healthcare information in a secure way. So how can we do this? So healthcare regulatory guidance and requirements, they are fundamentally uniform. It means that they are quite straightforward, and you just can use one of the frameworks, whatever you want or whatever you need, depending on the law regulations. And it's all this like regulations history started long time ago, and it is still in place, and the necessity is obvious. But it is not easy to follow all these rules, because we have a lot of amount of rules, and sometimes we definitely need help of organizations that will support us with the processes improvements, with the finding all the gaps in our processes, providing the audits for us. But if we will try to use the frameworks just in our regular work, and when we, for example, establish a new project or change kind of rules in our company, we can rely on these rules, on these frameworks, and this helps a lot. And when we understand the risk is so obvious, and we need somehow to deal with it, we actually need to verify our current processes, and definitely we need to introduce risk management, because it's very essential for the healthcare companies. And also we need to deal with external or internal audits in case of we are not going to somehow gain international standard. We still want to do our work in secure ways. So internal audits will help us to do so. And also we need to ensure that our documentation and traceability is in place. So all these measures and actions help to comply with the regulations, and to guarantee and somehow improve our cyber security situation. Thank you, guys. We are a bit out of time. Sorry for that. And do you have any questions?
Looks like not.
Sounds like not.
Guys, but please feel free to ask your questions if you have any.
Thank you, guys, for your time and attention.
Yeah, Iryna, thank you very much for this valuable information and for your time spent for the webinar. For rest of the colleagues, I'm kindly reminding you that if you have a topic for webinar or some other public, oh, there is a question. Okay.
Yeah, I
Yeah.
see it in the chat.
What is the regulation for mobile applications?
So I'm not aware of any kind of specific regulation for mobile applications. We usually use the same regulations as we do with with another types of applications, meaning that we use desktop. For example, the regulations will be the same. Andrea, does it answer your question?
I see that we have a question from Christian.
He's typing. I do not see it yet.
Hello, everyone. First of all, really thank you for such brilliant presentation and covering so much materials in 1 hour. Thank you. And this was very valuable. I'm not sure that we have time to questioning, but I want to say again my appreciation for this work and propose to think to create some kind of maybe workshop for BA solution architect and you're a product manager, some kind of and if you would like to participate, because it's very important topic that can help us to sell our client on the best way. And just an idea, and please ping me if you are interested in this. Thank you.
It's a really important topic. Thank you very much. Good idea.
Yeah, I see a question from Christian. Probably having in detail HIPAA privacy and security rules, what it means but for covered entities.
I'm not sure I understand in details this question. So we have for like having together this HIPAA and high-tech rules, we have 4 types of entities that are affected. They are healthcare plans, providers, clearing houses, and also business associates. That actually means for us any kind of third party helping organizations, some organizations that provides cloud technologies for us, or for example data analysis. All these kinds of organizations that we deal with are business associates, and for them we have these privacy rules and security rules. So for privacy rules, we deal with the security and safeguards to protect PHI information. We discussed during the seminar what information is treated as PHI, and we need to understand and be aware to prove that our PHI information, PHI data, yes, is treated in this secure way. So we do not disclose something. We do not have network breaches and so on. So we need somehow to prove this. In my previous organization, the same for security rule. Security rule supports privacy rules, so we need to establish kind of security measures for electronic PHI, and so that this helps us to apply this privacy rule, to have all the PHI information is safe. And so in details for different organizations, this will require different steps, different actions. We need to analyze a bit in each specific situation. For example, for my previous company, we did a lot to improve the network safety and how we deal with all the information that is stored and then exchanged inside our internal systems that help to produce our product for the USA healthcare market. So all the additional processes related to how we deal with emails, with how we secure our network and so on, it was the topic to discuss and improve. And I was not involved in these processes because it was more technical task. But as for from the business analyst analysis perspective and also QA perspective, we had a lot of improvements related to how can we prove that the change that we did to the system actually do not provide doesn't provide new bugs and gaps, so that we can have data breach, for example. And we dealt with different kinds of matrices and different kinds of additional scripts that day by day basis provided the statistics of what, for example, what automation test cases failed on, or what functional areas are not covered by tests, and so on and so forth. And this helped to during the audits, this helped to prove that we are good with the quality of our software, and also we are good with all the supporting software and processes that allows us to provide this good product to the market.
Thank you, Iryna. What I meant is maybe in detail would be helpful for everyone. What it means, in terms of HIPAA compliance, those with some practical aspects, what it means in relation to the cloud, who is the data controller, who is data processor, what kind of things various things on the privacy as well, what we can offer to our customers, right? Which are maybe the business associates, but we are, let's say, working with them or providing some basically processing of the data, or let's say we're helping them build the product, meaning we are not the business associates, but we need to understand what it means for them, what we need to comply with in terms of patient consents, who can access what kind of data in terms of entitlements, because I see a lot of confusion even around the customers on how they can leverage that data, because maybe sometimes the hospital is the data controller and not them, and they provide maybe the medical devices. Then obviously there are solutions like providing either mobile apps or other kind of platforms where you can ask the consent of the patients for the services that you provide, so you can leverage their data beside the hospital. So yeah, and also things that you enumerated now probably would be helpful either in the workshop as it was suggested, or maybe in another session to go into details would be maybe helpful for many of the participants. But
So,
thank you anyway for the sorry to ask so late the question.
Yeah, it's okay. We are out of time, but yeah, and I'm here to answer. So so let me just verify that I understand your request correctly. So it would be good to have a kind of webinar, so where when we will be able to dive deeper in details of the HIPAA security and privacy rules, to describe different cases and how it actually can be applied. Yeah.
Yeah, for example, also considering also, let's say, cloud scenarios, because many of our clients are building upon the cloud. They offer, let's say, solutions which either are HIPAA compliant or they can help you reach the HIPAA compliance, because there are other kind of things in order to reach the HIPAA compliance. It's not just technical, right? You need to have, I don't know, an officer who is responsible for this, for various aspects on the data privacy, etc. Then the service is a managed service. Maybe they offering the right security measures, etc. But depends how that is implemented. So kind of it's a shared responsibility, both on the cloud in terms, maybe they offer on the infrastructure level, but on the application side, you are responsible how you use those services to implement those security, privacy rules, etc.
Yeah, got it. Thank you, Christian.
No worries, and thank you very much as well. Very, very useful presentation.
Are there any other questions, guys?
Looks like not. Guys, thank you for your time. Iryna, thanks again for this info and for sharing. Great presentation, and wish everyone a good day.
Thank you. Thank you for your time.
Yeah,
Bye.
bye-bye, guys.